welcome back. It's Dr. Somji.
It's Dr. Solomon here.
Today we're talking about a treatment that for me has the most benefit within 15 minutes than any treatment that is offered at any aesthetic clinic worldwide.
And what is that?
It's the 15-minute nose job.
So the 15-minute nose job, otherwise known as the liquid rhinoplasty.
Yes, so if you think about it, when we talk about rhinoplasty, that involves anything that changes the nose. So the contour of the nose, any defects that you see within the nose or perceived defects, because just having a straight nose isn't the norm. In different, essentially ethnicities, it's quite normal. And in fact, in my view, in terms of beauty, sometimes it looks better with certain features. So, not always do you need to do this treatment. It's not essential. I mean, someone like Dr. Solomon's got a fantastically straight nose, but if you had something a little bit different, it might not suit you because of your ethnicity, right?
Yeah.
So,
well, people often come to us in the clinic and they are looking at the nose and they either think the nose is not straight or the nose is too big.
Yeah.
What they're seeing is the proportions, and we do like to see ourselves in the proportion. We like to see symmetry or harmony between certain features in our face. So whilst we say to anyone who comes in that there's nothing abnormal about your nose, there's nothing abnormal about the hump on the nose or the dip or even the deviation to either side, there are things you can do to either reduce it or to change the direction of the nose as well.
Yeah, and I mean, at the end of the day, we're doing this video because it's a very popular treatment. We're going to talk about the treatment itself. What is it? We're maybe going to talk also about the anatomy, the limitations of the treatment, comparing it to surgery, looking at the longevity as well as complications. And we also will show you also some before and afters as well that we've done, and talking about how we can do this quite safely as well. So let's start with the basics. What is it?
Okay, so a liquid rhinoplasty is essentially a correction of a nose contour using filler, and the most popular filler used currently is hyaluronic acid. So in the past, other types of filler were used, much more permanent fillers and fillers that we don't use anymore for various reasons, which we'll come into when we talk about the anatomy. But hyaluronic acid fillers are the primary choice for correction of, again, humps in the nose or dips in the nose. So that's a liquid rhinoplasty. How does that compare to an actual rhinoplasty?
So an actual rhinoplasty is a permanent change. So that's done either open through an incision just at the base over here, or a closed rhinoplasty. And if you've got a hump, for example, with a surgical rhinoplasty, that's shaved down, contoured. You may also elevate the tip using some cartilage, for instance. And that's a permanent change, and the recovery is a lot longer for a rhinoplasty. And like I said, you're changing your anatomy with a rhinoplasty. So it's more definitive. You can have better longevity with a surgical rhinoplasty. But on the drawback of surgery is that you've got essentially the downsides of surgery. So it's permanent change. So if you don't like it, it's very difficult to change it. It's not reversible. You can get certain types of scarring as well, which may deviate the nose, reduce the great contour that you may have achieved as well. And then also there's ENT issues as well. So if you're not actually got an ENT examination prior to that, you may end up with septum problems and breathing problems as a result of rhinoplasty. Now just remember, these things are quite rare, but nevertheless, when you're undergoing a permanent change in your body, you want to be sure that you like the nose straight. And this is where things like fillers are quite good, because you can get almost an idea of what your profile would look like adding some filler in there. And a lot of patients, even if they're deciding to have surgery on a later date, they sometimes just get it done just to preview and say, well, actually, yes, this does suit my face, it suits my ethnicity, have it a bit straighter. I don't want it too kind of sloped up, and I don't want that sort of like small pixie nose. I just want it nice and a little bit more contoured. So we get a lot of patients doing that too. So it's not either or. And then some patients don't want to undergo surgery. You might have health problems that means that you can't undergo a general anesthetic. You may have problems with healing and scarring. And this is where, fillers in a 15 minutes, it's quite low risk, relatively. And it can be done very quickly with minimal swelling and a minimal downtime. You're talking about even like 2 or 3 days and you're absolutely fine. So there's pros and cons of both. I think it's worth mentioning that in the last 5-6 years, I put threads in their nose. So the PDO threads and PLLA threads, the little threads of almost like surgical stitches that become your own collagen, so almost like a jelly-like fashion, and they're used to almost contour the nose, because that's another indication, not just the lumps and bumps, it's contouring the nose and also lifting the tip. And that's where threads coming down over here to lift the tip like this can also work to quite dramatic effect sometimes.
Yeah. So an important distinction I make between fillers in the nose and surgery is the volume.
Yeah.
When you are performing a liquid rhinoplasty with filler, you're adding volume to the nose. So you're actually making the nose bigger, and it's an important point to communicate with the patient involved. Whereas when you're having surgery, you're actually taking away volume. So you can.
But it won't necessarily look bigger.
It won't look bigger
if you do it in the right way, right?
Yeah.
That's the key point, because everyone asks, is my nose going to look bigger? Actually, because when you define the nose a lot better, it'll look slimmer. And if you don't over inject, where we're going to go through some anatomy in a little bit, if you don't over inject, then actually it'll look smaller.
It looks smaller, and that's what you do. You're creating an illusion whilst correcting certain contours, because there are limitations of where you can put the filler. As with surgery, you can take away bone, you can take away cartilage, you can reshape the tip, you can change the direction of the nose, and you can't do that with filler.
No.
But you can do that once, maybe twice with surgery, and the results are semi-permanent to permanent. Another important point is, if you change your mind, there is an element of irreversibility about that. Whereas with filler, it is filler, it's reversible. We just inject some Hyalase, which is a reversible enzyme, and then you reset back to where you started. So
absolutely,
that's an important point. The risks are equal in both categories. There are risks of surgery, there are the risk of hyaluronic acid filler, but there are advantages, significant advantages of both as well.
So what's the anatomy of the area? What should we be looking out for?
So the crucial anatomy that we need to look out for is the artery, the arterial supply to the nose. And the main arterial supply to the nose comes from the lateral aspects of the nose, and it's the lateral nasal arteries. And in terms of injection of hyaluronic acid, we need to stick to the midline, and we need to stay deep on the midline as well. Because whilst the variation of the arteries can occur between individuals, between ethnicities, and we know in some people don't even have those arteries, and some people those arteries deviate, the depth is quite consistent. So consistently, and it's been proven again in study after study, the arteries are in the mid layer of the nose. And if you were to inject deep, essentially onto bone, then you can avoid that in most cases. There are some exceptions to this. Somebody who has had a previous rhinoplasty, with the added scar tissue, everything changes. So in those cases, and either you don't inject the nose, or you inject it under radiological guidance, so ultrasound guidance.
Yeah, I think that's a real key point, right? Because the variability of the anatomy is so important, because people just blindly inject. Obviously, you've got to place the injection point, aspirate to make sure you're not in a blood vessel, and then slowly inject at low force. Because the problem that you have is, if it gets into one of these arteries, it can really flow back into the retinal artery, which supplies the back of the eye. And there's a theoretical risk, and there's also case studies of blindness associated with the procedure if not done correctly. Nowadays you can visualize these arteries with ultrasound. And the other thing that I would always say is that the blood supply to the tip is highly variable. And most positive aspirations that I've had have generally been in around the tip area. So I think, as you have to see someone that's really experienced in dermal filler injections to actually have a safe injection, because a lot of people, when you look online, they say, look at this amazing result. Most of the time it's over injected, and the more you inject this, the less safe it is. With liquid rhinoplasty, it's always done over 2 sessions, a few months apart. And that way it accounts for the swelling. And remember, it's a closed compartment, so if you inject too much, it could essentially, through compression, stop some of the blood supply, even if you haven't injected in that area. So I think you have to be really cautious with the nose. It's like a finity thing, less is more, and almost in an artistic approach. See it again for the second time and then perfect it. And once you've done it twice within that first couple of months, the longevity is pretty good. It's even like 12, 15 months, sometimes even longer.
Yeah, and the key with reducing complications, you can't reduce them to 0, but is to know your anatomy, make sure you're using the right product, and make sure you're injecting in the right area and not over-injecting, as you say. And there is a study we can link below in which a hyaluronic acid filler was injected into those who had rhinoplasty and those who didn't, and the complication rate was about 7% with those who had not had rhinoplasties, surgical rhinoplasties, and it was 10% with those who had. So the risk of complications is marginally increased. It is significant, but it's marginally increased in those who've had surgery. So you have to be extra cautious. And again,
100%.
we know a lot of people who do not inject noses with hyaluronic acid filler if you've had surgery. So complications can happen. They can never be reduced to zero, but you know your anatomy, careful injection, and you can significantly reduce that. So
Absolutely.
you're going to show us some fillers as well that we use.
I'm going to show you some fillers. As you know, in terms of a disclaimer, I do some work for Restylane. But the reason why I work for certain brands is because I believe in them. And Restylane's obviously got the longest safety rating in the industry. But there's two products that I would inject in the nose. The preferred one is Restylane Lift. And the reason why I inject this product is because it has what's called a high G prime. That means it's got a high resistance to any form of like deformation. So any pressure that's exerted onto it, it retains its shape. And that's exactly what you want in a nose. You want something that when you inject it there, it's going to stay there, and it sticks together as well, so it doesn't spread. And it just has what we call enhanced tissue integration, so it just integrates just into that area. So this is the reason why you can get some good longevity and results.
And that's what you want on, let's say, the bridge of the nose.
So you want like thin, small, precise injections within this area. I use both needle and I use both a cannula as well. Because with a cannula I can just like contour in one go, and then I perfect with little boluses of needle as well. And I think that's always a lot safer, using a cannula initially and then injecting with a needle.
And in fact, in one of our live demonstrations as well, we'll be showing exactly where we inject and why we inject as well.
Exactly. So, you know, Restylane Lift is a good option. There's many different things from different brands. If I'm just defining the nose, so for example, say if you have like a flatter nose and you say, I just want more definition, you can actually put a cannula all the way up here and just inject as you come out into almost like a thin strip. And this can be left there almost like a contour. So when you're contouring with makeup, this is where Restylane Define is actually very useful. This is also the same indication that I'd use to put nose threads in, because they sit there in a very precise location and just generate collagen in that area.
So you have a high G prime, which means a very hard product that just sits there, and then a low G prime, which will sort of integrate it to the skin.
Yeah, so this won't have so much of an integration. It's definitely got a higher degree of elasticity and a higher G prime. It's not as spreading as other products within the range. So it's going to stay there and define that area, but a bit more of a subtle contour. That's what it is. While this is lifting tissue up. So say if I had like a dip right here, I want to lift the tissue up. That's why you'd use Restylane Lift. If I then wanted more definition, then you'd do that afterwards. But generally, like I said, when you treated the nose a couple of times within a year period, the longevity is actually really good. And what I tend to do then is just, you only need like a small amount of the syringe, 1/10 of the syringe, just to maintain it. And then you can do little touches in different areas.
In fact, we see patients 2 years later that still have the filler in the nose.
Absolutely, yeah. And you know, remember, the nose is the middle of the face. So it has to be in proportion with every other area. So one simple thing that you can look at within this middle third is to look at the facial thirds and to try and match that in terms of your profile. And then the other thing is your facial fifth, so looking at the width as well. And with filler, you can reduce the nose width as well with injections just in this area. And that can also give that illusion of a more refined, slimmer nose too. So what are the complications that you see with nose filler?
So with complications, I divide them into anatomical complications and aesthetic complications. So with the anatomical complications, obviously the big one that we watch out for and we prepare for is an injection into an artery. And you know, with the nose, you have a potential obstruction of the tip of the nose and a cut-off of the blood supply to the tip of the nose. And you've also got a risk of an embolism of filler. So the filler being injected into the artery and being carried all the way to the back of the eye and causing a temporary blindness. Knowing your anatomy, whether it's under ultrasound guidance or not, you can reduce that risk significantly, but we also look out for complications immediately after injection. And we often do not discharge the individual having that from the clinic until about at least half an hour afterwards, by which point we will know. Other complications that can happen with any filler, you can have a filler migration. It can move into the surrounding area. The filler can drop down besides the bridge of the nose and actually create a wider bridge of the nose. You can also have an infection, which should be reduced, the complication rate should be reduced by hygienic practice, by sterile practice. And also you can get the aesthetic complications. The aesthetic complications, not only as we talk about migration, but that can aesthetically distort the nose. You can also get over-injection further up the nose. You know, we normally inject, as we'll show in the
So yeah, like there was something that I posted on Instagram a couple of years ago that went viral about Donatella Versace's nose, and it starts from in between the brows coming down.
Yeah.
That's a clear sign of over-injection, right?
We think aesthetically that the lash line is where the radix of the nose, or the sort of takeoff point of the nose, should begin. And in fact, that's often where the dip happens that then leads to the bump. So in the injection aspect, the liquid rhinoplasty, we tend to fill that dip. And that tends to be around the radix where the lash line is. If you fill or overfill, you go too high up, you end up with what's called the avatar look. So maybe you can tell us about the avatar look.
Well, the avatar look starts way too high, so it's not a sign of a human nose, and also it tends to be inadvertent because people worry about blood supply. So when they inject this area, they pinch, and when they pinch this area as they inject, the pathway of least pressure is upwards, and that's where some of the filler ends up in. And sometimes when I see in the complications clinic people unhappy with other previous injectors, sometimes, well, very often, probably about 20-30% of the time, I see product up here in the forehead, and that's the reason why they're unhappy, because it's accentuated that area. So I think that, you know, very small bolus injections, limiting the amount of spread with the right product, because people inject the wrong product, that spreads, and that causes havoc. Or even if you've gone to a good injector and that has happened, just like with anything, you know, it's like with sculpting, you're going to correct different areas. So, you know, you can use hyalays just to correct the area, small amount of dissolving under ultrasound, and then you'll still have a good result. So, you know, I don't think you should be afraid really of dissolving things after a 2-week period, because this is art. And, you know, which artist doesn't make mistakes and just draws a masterpiece just off of one go. No one does that.
And it's a great advantage of using hyaluronic acid filler that we can reverse it. We can start again, and you can reset it. And if the look that the individual wants differs from year to year, you can also change that look as well.
All right.
So where do you see the future with liquid rhinoplasties?
I think I see the future with small implants being put into the nose, like these threads that are there, because what you can do with these small threads, especially the ones that are PLLA, they do last for 2 years. They do create a little bit of collagen within the area and don't create so much inflammation either, so they don't really damage the tissue. But it lasts a lot longer, and it's very easy to put into that area, and especially if people want a little bit of a contour, just having that little bit placed there would actually be really, really quite nice. I like to combine both fillers and that sometimes, and I think that less is more. That's what I would say. And looking at, let's say, more higher G' product within that area, and also using ultrasound to make sure that you're safe, I think that's really, really important. Thank you so much for listening to that video. If you have any questions, just let us know in the comments below. Don't forget to like and subscribe, because we're always releasing new content. If there's any specific content that you want us to shoot and talk about, just let us know.